this, we're going to talk about shoulders, knees, and hips. We're going to talk about the joints, the soft tissues a little bit, and advanced treatments for these conditions. Now let's start with the knee. We didn't even get a knee. Let's find a knee here. Okay. So first thing with the knee. So what goes wrong with the knee? You know, you get older, you have some arthritic changes, and you've been told now there's not really good solutions. So they come in, they put a little hyaluronic, they put this lubricating gel in there. You feel like you have some temporary relief, but over time you continue to get worse. So, you know, regenerative medicine has shown such good benefit. So when the cartilage wears, rather than just lubricating it, what we're trying to do with this and what we're succeeding at is using platelet-rich plasma, we're using exosomes, we're using stem cells, and we're actually seeing changes within the cartilage itself. So, you know, if you're feeling that grinding, you know, difficult joint line pain, and you're not wanting a knee replacement, you know, looking at some of these tissues, we've really kind of found that the mix of platelet-rich plasma to activate it, and then coming in with a product called exosomes. And we've talked a lot about these in other videos, but exosomes are they're messenger RNA, and then we use either your stem cells or we use umbilical cord, depending on the patient. Sometimes we use both, followed with another PRP. We've seen some very good progress with knees, improvement with knees. In fact, we love getting knees, because when we get knees, almost everybody's happy with the outcome from regenerative medicine on knees. You know, so what else can go wrong with a knee? You tear a meniscus, right? So right in there, that little horseshoe-shaped deal right there, you get a little tear in there, so you lock, you click, and it's persistent. The body doesn't heal these things. So what's most commonly done? You know, they're going to go in there and they're going to take off the piece that's torn. And you know, sometimes that has to happen, but in the vast majority now, it doesn't. So what can we do? We can come in and we can scope in with a very tiny little scope precisely into that knee. We can see that meniscal tear. Again, we'll confirm it with imaging. And then we use the same thing. We use regenerative medicine. Platelet-rich plasma, stem cells, exosomes. We see great things happening, especially with medial meniscal tears. So those are the most common things. Now there's some other structural issues and tendinitis and all those other things that happen. Those are easy things to actually fix. The majority, the difficult things, the ones that are probably causing some significant long-term, is the arthritis and those meniscal tears. So there's the knee, but you know, don't go get a knee replacement unless we tie you to it at this point. Let's look at shoulders. So shoulders. You know, you're getting a little older. What's the most common thing? A disruption of the supraspinatus. The supraspinatus is this muscle that sits right above. So there's the shoulder. It's the muscle that elevates you. It's a very avascular muscle, not a lot of blood supply. So what's happening? You're getting these partial tears. Full thickness tears, you just blew that thing out and it's retracted. Dang it, you have to go get that surgically stitched together. Partial tears, though, why would we want to go in and get surgery if it's still hanging on and we can repair it? So we have very good success using these same types of regenerative medicine to heal partial tears within the rotator cuff. Other things that you certainly see, you know, these slap lesions. So like the meniscus, you tear the labrum. Inside that capsule is a piece of cartilage that helps the joint. So the joint goes in and the labrum kind of helps hold it in there. And you ride up on this and you tear it. So again, what are they going to do? Same scenario. Well, let's go cut it off. We'd rather not cut off everything that hurts if we can repair it. So we come in with the same scenario. It's a shoulder instead of being the knee. It's a shoulder. We can scope into it. Tiny little scope. We can deposit those stem cells directly into where that's torn. And we see great things with these labral fissures, with these slap lesions. We see great things with rotator cuff tears as long as they're partial tears. So shoulder joint in a nutshell, shoulder capsule in a nutshell, but most of these things aren't going to respond to exercise. They're not going to respond to you know, traditional you know, steroid procedures. And you know, I had a consult, and we had 2 today, and they were sent to us, said, get a steroid injection. My shoulder hurts, I had an auto accident, partial tear, we do an MRI partial tear. You know, they were sent over a steroid. If we put a steroid in a partial tear, he's going to have some temporary relief and go, hey, that was good. And then this guy in particular was going out to do his job, which was lifting. That steroid in the long run is going to have detrimental effects. And it's really quite a shame at this point to take a partial tear and put a steroid in there and break down that tissue. A much better alternative, especially with the price of different types of tissues getting cheaper, the ability to be better and more thorough on this. Stem cells used to be for athletes and movie stars. Now it's really available to the general public. Don't put a steroid in your partial tear, repair it in that case. Hips. Hip pain stinks because it limits your gait. You start to walk like an old man with that inability to extend that hip back. Your hip's starting to become arthritic. So what do? You wait till it's completely worn and then you go replace it, right? Now, hip replacements have good outcomes, generally. So sometimes that hip replacement is an okay thing. However, in the majority of times, it's still an invasive procedure. If we can get it before it's completely end stage, we can do the same thing. We can scope it, put deposits of tissue in there that aid in regeneration of cartilage, that aid in regeneration of that capsule. So with knees, we love, people with knees, everybody gets better. Shoulders, we're gonna look and see how torn it is, but if it's still partially there, let's try to regenerate it. Labral tears, absolutely. Meniscal tears, arthritic issues. Regeneration is just a better option at this point. And again, if we think you need surgery because it's so bad, we're going to tell you. But if it's likely to regenerate, why are we treating it with medications? Why are we damaging it with steroids? We should be regenerating it. So at Regenerative Center of Texas, that's what we do. And we're very comprehensive and we know what we're doing. So give us a call. We can consult with you.